Hey, Demetria Davenport here, the massage doctor. Today I'm going to be sharing some foot care tips for diabetics. So here we go. Just this camera. Alrighty. Okay. Alrighty. If you're diabetic, you always want to make sure that you have on footwear, a flip-flop, a house shoe, a pair of shoes. You always want to make sure that you have on shoes if you're diabetic, because you want to protect your feet at all times, because if you do get some kind of injury and you don't have footwear on, because you are diabetic, those little germs can get in your feet and cause a little problem to turn into a big problem. So we don't want that. So you always want to make sure that you have on some kind of footwear to protect your feet. Okay? Next, when you are washing your feet, you want to make sure that you're drying. When you're washing your feet, you want to make sure that you wash your feet. You want to wash it really well. And then once you rinse your feet off and dry them, you want to make sure that you have a towel, and you want to go and you want to dry your feet really well. You want to go in between those toes and make sure there's no moisture in there in between those toes. So you want to dry your feet really well. Okay, you want to examine your feet, touch your feet, see if you feel any difference in your feet, change in temperature. Also, if you feel anything, any lumps or anything that feels not natural, you want to check for that as well. You want to check in between your toes. See if you see anything, any cracks or blisters in between your toes. You want to examine your toes. Okay. Then also you want to, when you're filing or trimming your toenails. What toenail clipper is that? Hold on. When you're trimming your toenails, you want to make sure you want to trim straight across. Okay? You want to trim your toenails straight across. If you're filing your toenails as well, you want to make sure, I'm just going to use this for example, but if you have a file, it's a little file on this toenail clipper, you want to file straight across the toenail. You want to file straight across. Okay, if you're seeing a podiatrist on the monthly basis, that's excellent, because when you're cutting your toenails, you want to make sure that you don't cut them too close. Okay, you want to prevent any kind of injury to your feet. Alrighty, you want to examine the bottom of your feet. So you want to check the bottom of your feet and toes for any blisters. Anything that may seem out of the ordinary, you want to check for that. In the event, if you cannot check the bottom of your foot, you can use a mirror. So you can lift your feet up like this, and you can check the bottom of your feet, or you can just take the mirror and put it on the floor and look at your feet. See if you see anything. Yep. You do like this. Put it at an angle so you can see, to check your feet, to see if you see anything out of the ordinary with your feet. So guys, you can use a mirror. And then also, you want to document any changes that you've noticed in your foot. So you want to keep a journal for your feet. If you're diabetic, you want to keep a journal. So if you experience or notice any changes in your feet, you can document that as well. Also, don't walk around barefoot. You don't want to walk around barefoot. Again, you want to make sure that you have on some kind of shoes on, okay, on your feet. Make sure you're wearing shoes that fit properly. You want to make sure the shoe is comfortable for you. Also, you want to make sure that you're wearing breathable socks. These are some breathable socks. Also, they're known as dry fit socks. This will help pull away any moisture away from your feet. So these dry fit socks will help keep any moisture away from your feet and in between your toes. Also, these are pretty cushiony. Also in the arch at the toe area and also on the heel. So these are cushiony as well. Okay, so you want to make sure that you have a comfortable sock and that it is breathable. Okay, and it pulls away moisture away from your feet. Make sure that you're seeing your doctor, your podiatrist on a regular basis, so you can make sure that your feet is you're maintaining a healthy foot care for your feet, especially if you are a diabetic. And then also make sure that you're taking any medications, your diabetic medications. Make sure you're taking your meds on a regular basis to help ensure that you have proper diabetic foot care. And also, this routine is good for people who are not diabetics. Make sure you guys, you check your feet before you do any changes to your healthcare regimen. Always check with your primary care physician. The massage doctor signing out. Mwah! Love you. Bye.